So please lie on the floor and just begin a few moments of breathing, connecting, arriving. Just feeling how you allow yourself to be supported by the floor. The back of your head is supported. No effort is required by your neck. Back of your shoulders and shoulder blades. Each of your arms. Back of your lower ribs. Even your low back as it curves away from the floor. There's support there, support between the lower ribs and the buttocks. And of course, as always, if it's more comfortable to keep your knees bent, do so. And if you're able to keep your legs long and your knees straight, you can do that. Always listening. All of these practices are to allow you to listen more deeply, honor and respect your body more genuinely, so that in everyday life you're not just stepping out of yourselves and doing things that may end up creating more pain later. And then continuing to feel the support of the floor underneath your pelvis, your hips, your right and left legs, and underneath your heels and feet. And I want you to imagine that you're lying on a balance beam. Make it wide enough so it's not too uncomfortable in your imagination. But if you were on that balance beam, and maybe there was some fluffy, floaty air to the right and to the left, so you weren't feeling completely unsafe. But begin to notice which way might your body be sort of leaning off of that balance beam. And it might be different at different parts. So let's just start with your head. If your head were going to roll off the balance beam, would it roll to the right or to the left? And you might even just play with just kind of rolling your head a little each direction and just noticing which direction's just a little bit easier. So we're just tuning into our natural asymmetries. And then just let your head rest. Bring your attention back to your shoulders and shoulder blades. And if one shoulder was going to roll more downwards towards the floor, lulling off of the balance beam, which shoulder would it be? And is it the same side as your head? So let's say you felt an inclination for your head to roll more rightward off the balance beam to the right. Would your right shoulder also be more inclined to rolling off the balance beam? Or maybe in this scenario it's the opposite shoulder. Maybe you've got a little twist going on. Probably not the first time somebody called you twisted. At least not mine. And then just bringing your attention down a little further. Shoulder blades and those lower ribs. The ribs just below the shoulder blades. And just in that area, is there an inclination to roll one way or the other off the balance beam? You can play a little bit with movement if that's easier for you, or you can just Sort of take your first impression as you lie here. Letting that go. And tuning into your pelvis. Which side of your pelvis is more likely to roll towards the floor off the balance beam? And again, is everything going to the same side? Is everything rolling off the balance beam to the right or to the left? Or do some parts of your body feel more inclined to go one way while others go the other way? And then you can even bring this awareness and attention down to each of your legs. Do they follow the direction of your pelvis? There's one leg maybe rolled out a little more likely to just kind of fall off that balance beam. And then just go back through the scan, checking in again with your head for a couple of breaths. Your shoulders. Your ribs. Down to your pelvis. And to your legs. So sometimes in the middle of the day, when life just has us hurried and worried, just pausing, just connecting, grounding to sensation in any way, whether it's 10 seconds of sensation or 5 to 10 minutes of just getting back into your body. That's what these beginning practices are. Simple ways to drop back out of the busy mind, the mind that thinks and thinks and thinks. One of my patients yesterday called it the committee. The committee in there has lots to say. But when you drop into the sensations of your body, then for a few brief moments, the committee is less in charge. And we bring back balance to our lives. Out of the sympathetic fight or flight, into the parasympathetic rest and digest. Thank you.